Why nursing theory matters. Nursing is more than a collection of tasks. It is a discipline grounded in science, guided by philosophy, and shaped by human experience. Nursing theories provide the structure that defines what nurses do, why they do it, and how they influence patient outcomes. Definition: Nursing theory. A nursing theory is a structured set of concepts and explanations that describe, predict, or guide nursing practice. In this narration, you'll explore the major nursing theories that form the foundation of modern care. You'll learn what each theory means, why it matters, and how it applies to real clinical situations. Let's begin. The origins of nursing theory. Nursing theory began with Florence Nightingale, the pioneer who transformed nursing into a scientific profession. Florence Nightingale, environmental theory. Definition: a theory stating that the environment, including light, cleanliness, ventilation, and noise, directly affects patient healing. Nightingale believed nurses play a critical role in shaping the environment to support recovery. Her ideas laid the groundwork for infection control, hygiene practices, and holistic care. This was the birth of nursing theory, and the beginning of nursing as a science. Chapter 2: Grand Nursing Theories, the Big Picture. Grand theories offer broad, conceptual views of nursing. They answer the question, what is nursing? Hildegard Peplau, interpersonal relations theory. Definition: a theory that views nursing as a therapeutic relationship built on communication, trust, and collaboration. Peplau's work emphasizes the emotional and psychological dimensions of care. Virginia Henderson, need theory. Definition: a theory stating that nursing helps patients achieve independence by meeting 14 basic needs. These needs include breathing, eating, movement, rest, safety, communication, and learning. Dorothea Orem, self-care deficit theory. Definition: a theory explaining that nursing is required when patients cannot perform self-care. Orem believed nurses should support, teach, and empower patients to regain independence. Sister Callista Roy, adaptation model. Definition: a theory describing patients as adaptive systems responding to internal and external changes. Nurses help patients adjust physically, emotionally, and socially. Grand theories define the identity and purpose of nursing. Chapter 3: Middle-range theories, connecting ideas to practice. Middle-range theories are more specific and easier to apply in clinical settings. They answer the question, how do nurses care? Jean Watson, theory of human caring. Definition: a theory emphasizing that caring, presence, and authentic connection promote healing. Watson highlights the emotional and spiritual aspects of nursing. Madeleine Leininger, transcultural nursing theory. Definition: a theory stating that culturally congruent care improves patient outcomes. Leininger reminds nurses that culture shapes beliefs, behaviors, and healing. Catherine Kolkaber, comfort theory. Definition: a theory proposing that comfort, physical, emotional, and spiritual, is a measurable outcome of nursing care. Comfort is not optional, it is therapeutic. Nola Pender, health promotion model. Definition: a theory explaining how nurses can motivate patients to adopt healthy behaviors. Pender focuses on prevention, wellness, and lifestyle change. Middle-range theories bridge philosophy and practice. Chapter 4: Practice-level theories, tools for the bedside. Practice-level theories are narrow, specific, and highly applicable. They answer the question, what should nurses do in this situation? Kristen Swanson, theory of caring. Definition: a theory describing 5 caring processes: knowing, being with, doing for, enabling, maintaining belief. Swanson's work guides bedside communication and emotional support. Merle Michel, uncertainty and illness theory. Definition: a theory explaining how patients experience uncertainty and how nurses can help them cope. Michel's work is especially useful in chronic illness and critical care. Practice theories guide moment-to-moment nursing decisions. Chapter 5: How nursing theories shape clinical practice. Nursing theories influence every part of patient care. Assessment. Henderson's needs, Orem's self-care, and Roy's adaptation guide what nurses look for. Interventions. Watson's caring, Kolkaber's comfort, and Swanson's processes guide how nurses act. Communication. Peplau's theory shapes therapeutic communication. Cultural care. Leininger ensures care is culturally appropriate. Health promotion. Pender supports teaching and prevention. Definition: evidence-based practice. The integration of research, clinical expertise, and patient preferences to guide care. Theories strengthen evidence-based practice by providing structure and rationale. Chapter 6. Why nursing theory makes you a better nurse. Nursing theory enhances critical thinking, clinical judgment, communication, leadership, patient outcomes, professional identity. Definition: professional identity, the internalized values, beliefs, and behaviors that define a nurse's role. Theory strengthens that identity and elevates your practice. Carrying theory into your practice. Nursing theories are not just academic concepts. They are living tools that guide your assessments, your communication, your leadership, and your compassion. By understanding these theories, you elevate your practice. You become more intentional, more confident, and more effective. You join a long tradition of nurses who think deeply, act purposefully, and care with wisdom. Your journey into nursing theory is a journey into the heart of the profession, and into the nurse you are becoming.